According to the CDC, lung cancer is the biggest killer in men and women, with 200,000 people in the United States being diagnosed and 150,000 people dying every year. November is Lung Cancer Awareness Month, and doctors are reminding some high-risk groups to get their annual screening.
If you've been a smoker for a long time, usually at least 20, 30, 40 years, you qualify based on most insurances to go get a CT scan where you go through that little donut, they shoot some x-rays through your chest, and then we get to look inside.
If the doctor sees a mass in the scan,
we can do further testing like a biopsy or what we call a PET scan to see if it fits with a lung cancer or a lung nodule.
After diagnosis, treatment can start, and there are multiple ways to treat lung cancer.
So in terms of the chronological order, to treat the cancer, surgery, chemotherapy, and radiation treatment.
If possible, doctors will remove the cancer.
If you have lung cancer on one side of the lung, yeah, you can cut that whole thing off. You can cut the whole side off. I mean, that's actually the standard treatment for lung cancer. They do a lobectomy.
If that's not an option, patients will undergo chemotherapy or radiation in hopes of stopping the cancer before it spreads.
The tumor cells, the size is similar to bacteria. Even if you have one bacteria that you cannot see, it could run around anyway, right? Because cancer cells run around in the blood. That's how they spread.
New technology cuts down the time it takes to treat lung cancer.
Instead of 6 weeks or 6.5 weeks, if you have the right equipment and right personnel, you can get it done in 5 treatments.
Arnot's machine, the linear accelerator, doesn't expose large parts of a person's body to radiation.
Because the machine is actually an X-ray machine, except it's designed to do pinpoint X-ray.
And linear accelerators don't usually cause reactions people typically associate with radiation.
I don't see a lot of skin reaction, okay? Because we don't cut people. So even if they were to get it, it will be like a sunburn.
Dr. Sang says cancer patients are always told what treatment option would be most effective, but at the end of the day, they decide what treatment they want. For Arnot Health, I'm Lexi Cutmore.